name is Eric D. I'm co-founder and CEO of Bloom Technologies.
Sorry.
This one. Over the past 4 decades, there's been an increasing number of pregnancy complications, often leading to preterm birth. These diseases not only cost our healthcare system billions of dollars, but often leave women and children with a lifetime of disability or chronic disease. As a result, expecting moms often feel anxious and powerless, regardless of whether or not they're low risk or high risk. The only time to get any sort of peace of mind is during their prenatal checkups. But these are inconvenient, expensive, and still leave moms with tons of questions because they rely on antiquated 40-year-old technology. Sadly, there are no other options, but we're here to change that. At Bloom, we're designing the future of prenatal care with technology designed to improve the health of moms and babies. We combine wearable devices with data analytics to both reassure moms and provide doctors with better information to improve birth outcomes. For expecting moms, Bloom takes the guesswork out of pregnancy and puts need-to-know information about her body and her baby at her fingertips. Every day, a mom wears her Bloom patch, and through her smartphone app, she can easily track how much her baby's been moving, which lets her know her baby's healthy. She also receives personalized feedback on whether or not she's been pushing herself too hard at work, or whether or not she could use a bit more exercise to meet her doctor's recommendations. Throughout the 3rd trimester, moms could also track her contractions to see how her body's preparing for labor. Having access to this type of information gives moms more confidence in her body, as well as facilitates better conversations between her and her doctor. All of this is made possible by our amazing, lightweight, medical-grade sensor. This device can measure the most important health information of mom and baby from conception to birth. And this includes pregnancy-specific information no other wearable can track today, such as contractions, fetal movement, and fetal heart rate. This is a huge step forward. Existing solutions don't track anything about the health of the mom and are neither safe nor convenient for continuous use. And emerging solutions only track individual parameters of mom or baby. Our system has been validated in 3 clinical studies where we've benchmarked the performance of our system against hospital-based systems. We've already started shipping beta units in anticipation of a larger market launch mid-2016 and have already helped deliver dozens of healthy moms and healthy babies. The feedback so far has been overwhelming. It's clear we're striking a chord with a passionate and engaged group that has been overlooked for way too long. Bloom will first launch direct-to-consumer through a monthly subscription. With the subscription, moms will receive the reusable sensor and disposable patches. After having her baby, she can easily return the sensor to us or pass it on to another mom. After securing FDA clearance, we will further seek reimbursement and adoption within healthcare systems. Now, the team behind Bloom, we've developed some of the most advanced wearables in consumer and medical markets over the past decade. We have successfully built innovative mobile health solutions for market leaders in cardiac, sleep, and brain monitoring, and we're excited to tackle the biggest challenges of maternal health. Thank you.
Thank you, Eric. Judges.
Eric, thank you. I'm a mom and apparently wasn't anxious enough to be the market for this. So what I'm trying to understand is to what extent Bloom is an anxiety quelling tool, and to what extent, can you give me sort of the clinical value proposition for a mom and what that mom might learn and do as a result of Bloom that didn't exist before?
So I think there's a few things. There's the clinical value prop, and then really it's about mom. And for us, the future of healthcare is really at the intersection of these 2 things. We found for a lot of moms that there's a lot of guessing in pregnancy, that they're not really sure what is this sensation they're feeling. And as part of regular prenatal checkups, doctors will ask moms, have you been having contractions? How much is your baby moving? Have you been getting enough exercise? Have you been pushing yourself too hard? And a lot of this is guesswork for both the mom and the doctor. And so what we try to do initially is just take that guesswork out by providing very accurate and objective information about these parameters to facilitate that conversation between the mom and the doctor. And then as we move forward and really start to unpack the value of this data, to start to answer the higher level questions. Am I in labor? Is this a Braxton Hicks contraction? Is it a labor-inducing contraction? Is my baby actually healthy? And these aren't questions we could specifically answer today because they need to be more clinical validation around it, but we're building the data set necessary to answer those questions.
And I'll just add on to that. So you've got 2 big hurdles, which is FDA and reimbursement. I'm not sure which one's bigger, maybe reimbursement. So that is the question, which is you've got this nice market, whether it be for anxiety or for other reasons for moms, direct to consumer. you've got to get over those hurdles to sort of get to the point, to your ultimate vision, which is reimbursement. Give me a sense of what you think the time frame is for FDA, and what do you look at as sort of prior art around getting reimbursement? Are there other things that they've already paid for that you could take advantage of?
Sure. So we look at really two phases to the company. Really, first is a direct-to-consumer play where we've worked with regulatory experts to define out where is that boundary between regulated and non-regulated. We can launch with a consumer version where we don't actually provide all the information to the mom. That would fall under an enforcement discretion category. So that's what we're first do. That allows us to get to market, validate the end-to-end user experience, build a customer base. The system has been already designed to medical standards, so all the quality management systems around it. We will take a sequential approach through the FDA. So each one of the features that I've highlighted will get through the FDA in its own 510K filing. There is a predicate device to this. It's the cardiotocogram. These are the systems that are used in the hospital today. So what we've already shown today is clinical equivalence to that. Right? So we say, okay, where as accurate is that? And for us to submit to the FDA, we're looking at it from the time we start to repeat the studies we've already run with the documentation, about 9 to 12 months for each one of those. And so we do contractions, fetal movement, and as we start to move forward, the larger filings around predicting preterm labor, predicting preterm birth, obviously those are ones that require a substantially more complex filing. Those would be more of like a class 3 or a PMA or class 2 with a PMA. So those are going to require more time, but we start with the consumer because it provides that revenue base and that customer base, which gives us a shot to get to Mars, right? If that's the goal, you need to get to Moon first, and then there's a jump-off point. And we believe that this approach of going consumer first, which allows us to both generate revenue and crowdsource consumer-generated data, is the only way we actually move the needle in obstetrics.
So what happens right now? Let's say someone is concerned. Do they take the data to their doctor, or is there a call center, or both? How does that work?
Yeah, so right now, we're not linking in with EHRs. That's sort of the next sort of intermediate step we'll go. So right now, moms have the access to the information they can share with their doctors as regular part of their prenatal checkups. So we spent some time working with clinicians to find out how would you want this data presented when moms call you, what questions are you asking? And so we provide that information back to moms, so when they call, they can easily report out exactly what the doctor's going to ask them. So it's initially just about facilitating that conversation.
Do they print out, is there a form that they can print out and show to their doctor?
So we've enabled a sharing function so they could share and just like text message it or email it into their doctors.
Okay.
Can I ask just a quick question? So I'm a little biased here because I'm an investor in Bellabeat. So, you know, they've made huge progress. Is there really room in this market for multiple players like that? I mean, they've destroyed it in this market, to be blunt.
So Bellabeat has developed a Fitbit. It's a Fitbit. They have
Baby Watch Home is not a Fitbit.
So Baby Watch they removed from the market because fetal Doppler. Actually, the FDA has recommended against any fetal Doppler systems that came out last year. I know they have something else they're working on, which is the Shell, right? Which was more of an acoustic-based monitor. It's something you have to hold onto your belly. There is clear opportunity here. I mean, just measuring step counts alone is not going to get you to the grand goal of actually impacting outcomes. You need to have information around contractions. You need to have information around fetal heart rate. You need to have continuous information around fetal movement. That's what we could collect. And our team has been developing these systems for over a decade. So we know how do you capture these very difficult to measure physiological signals, and how do you make sense of it? Just collecting the information is not even half the battle. It's really how do you contextualize it, and how do you distill that into really meaningful insights, both for doctors and for moms.
Mark, what do you think?
So it sounds like, Eric, what you're saying is it's a two-phase process. The first phase is, going out and reaching consumers, reaching moms, selling peace of mind, selling hypothetically fewer visits.
That's right.
Fewer doctor visits, which is time, and a lot of moms are busy. They have jobs. This is to me, this is eminently valuable in the short term. Later term is basically getting to a big data model, having the analytics, have the FDA approval, potentially getting some of the reimbursements, where this becomes more than just as Cammie said, sort of a feel good. This becomes actually a real way to basically have a baby.
That's right. Just being able to tell a woman whether or not she's in labor or not, there's clearly value there. In discussions with Texas Children's Hospital and UCSF, they assume that every mom at least half of moms will have one false call with the rush to the emergency room. These typically cost about $1,000, and they're unnecessary. So there's costs there that you can pull out, just providing that peace of mind. So there's near-term opportunities to reassure moms, to reduce unnecessary healthcare utilization, to improve doctor-patient communication, to improve quality metrics around that. I mean, there's a lot more going on in healthcare to that extent. But the longer-term opportunity is really to help doctors better predict and manage pregnancy complications before too late. And I think we have a really good shot of doing that.
Eric, thank you very much.